Oh my God. What's going on, everybody? I'm Dr. Jim Cellini. I'm a board-certified practicing veterinary neurologist, and on today's video, I'm going to react to another episode of the Animal Cractor. This is an animal chiropractor I reacted to last year. You guys seem to like it. And after you watch the video and hopefully listen to kind of some of my commentary, I think you'll understand why I'm so concerned about animal chiropractic in general. Let's start this video.
I took him to the vet. And they did x-rays. He didn't need sedation. He did great with the x-rays, and they found a dislocated hip.
Okay.
I asked them if they could adjust it. They told me if it would have been right after it happened, we could probably, I'm like, it hasn't even been 24 hours.
Yeah. And
they referred me to the hospital. He said he might need surgery. They might have to cut the head of the femur. Yeah. And that's not the route we want to go.
If I can, based on my experience, what I'm guessing happened was the primary care vet diagnosed a dislocated hip and then recommended that she go to either an ER 24/7 facility or maybe like an ER specialty hospital with orthopedic surgeons there to address this. Putting the hip back into place is not something that every like general practice or primary care doctor is comfortable doing because they may not see it very often. It's more of an ER or surgeon thing to take care of. So I think it sounds very reasonable that if a primary care doctor wasn't comfortable doing it, they'd say, yeah, go into an ER hospital, see if they can help get the hip back into place with what's called a closed reduction, meaning you just manually kind of pull it back and turn the hip back into place to get it back in there, or maybe talk about surgery if that fails. I think it sounds very reasonable what the vet talked to her about, and I don't know why it's being presented in this video as some sort of like out there recommendation. It all seems very standard from what I can tell. And also one more thing, the surgery that she mentioned with cutting the head of the femur off, that's called a femoral head ostectomy or FHO. It's a very common procedure done in hospitals across the country. It's probably, dare I say, the simplest, most straightforward orthopedic surgery that we do in dogs. And dogs typically do very well with it. Yes, it's surgery, and I don't want to downplay what orthopedic surgery is and how serious it can be, but presenting an FHO as if it's like the equivalent of a hip replacement or something that's like extremely invasive and like, you know, aggressive, I think is a little bit unfair, so I wanted to present that side of it too.
He's not even a year old.
But they could see it. Do you have a picture of the x-ray? Mm-hmm. Can you show it to me? Sure. Shay, I'm putting my glasses on for this. Okay. You can see that's where it's supposed to be. Mm-hmm. So it's really out of position.
So this is kind of the first major problem I have is it looks like he's interpreting an x-ray on a dog, and I don't know how this doesn't fall under practicing veterinary medicine without a veterinary license. He's making judgments based on the x-ray. He's describing to the owner what the x-ray shows, and he's about to do a treatment based on the x-ray. So I don't know what I'm missing here.
There's different ways for me to set up on this. He's probably going to yell.
Yeah, I know he is.
You know, I would.
Yeah, absolutely.
You know, but if I get it, it's going to be amazing. Okay. Yeah, if I don't, well, let's see what happens.
So what he's about to attempt here is what's called a closed reduction. This is a non-surgical method of getting the hip back into place. So what you're generally going to try to do when the ball of the ball and socket joint is out of place like that, you're trying to just pull the leg back and bring it into the socket. The standard of care to do this is to have dogs under anesthesia when you're doing this because it is extremely painful. No dog is going to just allow you to do this without putting up a big fight. In fact, the more they fight you, the more chance you run of damaging some structure around that ball and socket joint and making things worse. Right off the bat, I have major concerns that we're about to do a closed reduction with no medication on board whatsoever.
And this shouldn't be bad because this is the good side. Fine, yeah. So my thumb is on the head of the femur.
Okay.
So you can't feel the head of the femur by just like touching from the outside. It's buried inside that ball and socket joint. I'm not really sure what he's talking about here.
And if this doesn't, then we flip him on his back. But usually most dogs don't like to be flipped on their back because it's a submissive position. Mm-hmm. And if he doesn't really know me, he might not feel comfortable doing that, exposing his belly to me. So I'm going to put my hand under his belly, lift up, and I'm going to get my hand right on there. Oh, God.
So you can see already this dog is experiencing a lot of pain as he's just even like barely touching the femur. This is why it is standard of care to have these dogs under anesthesia or at least heavy sedation with like an epidural on board to do this because they're in so much pain. I mean, you can imagine that dislocated hip is like an extreme amount of pain, right? The other problem I have with this is that the owner is tasked with restraining this pet while he is doing this closed reduction. That is just, it's all sorts of liability. I mean, I know he's got a muzzle on, but dogs get muzzles off all the time. And it's just like, it's not fair to ask the owner to do this.
Okay.
He's,
okay.
now you might have to control his head a little bit.
It's okay.
Okay. Sorry, baby.
I'm sorry. Sorry, Shay. Sorry, Shay.
Oh my God.
Did you do
Stop.
anything?
Didn't go. It's really out.
It's okay. I'm sorry, Pete.
Put him on his side. He's facing that way. Sorry, baby.
Sorry,
It's
Shay.
so out.
See how the dog's panting? That's another sign that the dog's in a combination of pretty significant pain and anxiety at the same time.
Keep him on the table.
The sad reality of the situation is that we're asking somebody who's not in the veterinary field at all to restrain an animal, and there's a certain way to do that. You see him thrashing around and fighting, and all that. It's just, this whole situation is just kind of a mess.
It's okay. You're gonna hate me after this. It's okay, baby.
So here comes this activator thing. I have no idea what this thing could possibly do or how it could help the situation. So at this point, if I was standing there as a vet, just in my professional role as a veterinarian, I would be telling everybody to please stop. Like, I have to speak in the best interest of the pet at some point. So I would be saying, we're stopping. Like, if I was a referee right now, I'd be like, stop. And you see, she doesn't even, again, I'm no shade to this person at all. I truly, no shade to this owner whatsoever. But she's not being educated enough by the chiropractor to even know that he can't give pain medication because he's not a licensed veterinarian.
So I was able to get it closer, but it didn't snap into its little socket. And I think that's the most I should do right now because...
Now, this is good judgment on his part. I do applaud him for that, okay? But listen to what is said next.
But I don't want to just go for it because he's like traumatized a little bit because it's so painful.
Yeah.
And he wet himself. Can you feel?
Yeah. I felt it on me.
Yeah.
Again, it's common for dogs to pee themselves when they're extremely painful and anxious, like this dog is.
I'm hoping he doesn't need surgery. I think a lot depends if someone's willing to sedate him and then see if they can traction and pop it in.
Yeah, so this is good. Like, he's talking about how, the dog should be sedated and then have it done, which is what I think the first vet probably recommended in the first place. Like, why are we even here?
What is your thoughts? Do you feel like you want me to just go for it? Do a little bit more?
What do you think?
I don't think I can hurt him. I mean, I think...
A couple things about this. One, it's an unfair question to put the burden of what to do on the owner. Yes, you can give them information and get a yes, no, approve, disapprove sort of thing. But I think this gets into the realm of asking them to make a medical judgment, which is an unfair ask of a person who's not medically trained. You can kind of tell she's like not sure. And she's kind of just reflecting it back to him immediately. That's what people do when they're not sure. They're just like, no, you tell me what to do.
I mean, I think it hurts.
Yeah,
but I don't
as
think
long
I'm
as
gonna...
you're not gonna hurt him. Yeah.
No.
I disagree. I think the more this dog thrashes around and the more attempts you make to try to do a closed reduction, you run the risk of taking a stretched out ligament or joint capsule surrounding that joint. And if it's strained and you keep trying to get it back in and move it around and the dog's failing, I think you run the risk of tearing something, and that can be a more complete, incurable injury with a closed reduction. So I don't think that's accurate either. I think you actually do run the risk of hurting him and making the situation worse, the more attempts you try with him awake.
Good boy, Shay. Good boy.
So you can see how worn out this dog is. Like, this dog is completely just exhausted from this entire experience already, and it's not over yet. So
What?
He's such a puppy too,
Yeah. With what you felt, you think if you try a little more, you might.
I just don't understand why he can't come to a decision that is, look, we tried, you need to see a vet. Why is that so hard? Like, look, just stop doing this for a second, okay? Just turn it off, okay? Go to your vet or go to a vet to have this done.
But like, I'm not going to structurally hurt him. Do I feel good about it? I mean, this is, breaks my heart too. Stretch his leg straight right now, the left leg. and move it down towards the scale.
This is another part I really disagree with. I would never ask a client to do something to their pet that elicits the pain response that we've seen demonstrated, many times right before this. I don't know why he's doing this, and it makes zero sense to me. So fair warning, this is the worst part of the video in terms of the dog's pain level. So again, if you think you might be bothered by that, feel free to skip ahead or skip altogether.
Sorry, Shane.
I think I got it. Let's hold him for a minute. I heard it snap right in. Let him chill out first. Did you pee
This
on you?
was worth it. Yeah, I don't care.
I did click it in. I felt it go. So hopefully that was it and it doesn't come right back out.
I hope so. I would have passed out.
So he is right, it could pop right back out, especially if he has hip dysplasia. The success rate, just so you know, the success rate of doing this is about 50%. 50% of dogs, the hip will stay in, and 50% of dogs will just pop right back out again, and they'll need surgery.
So we'll either see him look a little different, but if not, what I'd like you to do is carry him and then get him into a crate, perhaps. Do you ever put him in crates?
I do. He sleeps in a crate.
And keep him crated as much as you can for the next 24 hours so it can not just go out again.
Got it.
So he's going to need a lot more than 24 hours worth of crate rest. It's probably going to be a few weeks, I would imagine. Just one day is not going to be enough time for things to heal. He's going to need multiple weeks. Getting out of his crate and doing too much prematurely would run the risk of it popping back out again.
And then put him on his body, put him on his feet if you can. Hold under his belly.
Good boy,
And he might not put weight down yet, but go get him.
That's better.
Is it a little better?
It's more down than it usually is.
And then let's connect tomorrow and talk about it.
Okay.
So those two little 3-second clips of him walking before and after is not enough to really know if he's using the limb better or not. They just took literally, I think it's 2 to 3 seconds of him walking. These things can be kind of on and off with their gait, and they can sometimes put their leg down and then put it right back up. I would not use those 2 clips to judge anything regarding whether or not he's better or not.
Oh my God, Dr. Willen, guess who woke up walking today? Hi, Dr. Willen. So this is Shay, or recovered.
So the day after having a dislocated hip, you definitely should not let your dog be on the couch. They definitely should not be jumping off the couch or doing any sort of running and jumping this soon after such a major injury. Now, I'm sincerely happy if this dog is indeed better. I truly wish the best for this dog. I'm obviously not, trying to hate on the dog or anything. My concern here would be what's the follow-up? Is this dog still doing fine? Did the hip pop out the next day? Did we just instantly go back to our normal level of play afterwards? And as with most of these types of videos, none of that is laid out. To summarize, I would never ever recommend performing a closed reduction of a dislocated hip in an awake animal with no sedation or anesthesia, and I have no idea how this is not considered practicing veterinary medicine without a license. But despite all that, it seems as though this dog is doing much better, and if what he says is true in the comments, hopefully this dog has a good quality of life and doesn't continue to struggle with this hip being an issue going forward. Alright guys, hope you enjoyed this reaction video. I wanted to put this out there because I thought some of the stuff that was done in here was just, like I said, substandard care, and I think this sort of stuff needs to be analyzed and discussed from a veterinary medicine standpoint. Please, if you don't mind, hit the like and subscribe button and leave a comment below. Let me know if I missed anything or if you agree or disagree with any of the things I discussed in this video, and I'll see you in the next video. Thanks a bunch.